There we go. It worked.
Good morning, Gila. How are you?
I'm doing. How about you?
I'm good. It's a sunny day in Los Angeles.
It
Um,
is.
for those who do not know me, is it okay if I introduce myself?
Please take the time. Go introduce yourself to the Yesh Tikva community.
So my name is Natalie. I am somebody who works at JScreen. I'm a genetic counselor, and my job is to be on the outreach and education team. And we have followers from JScreen that are watching as well. Gila, can you tell us a little bit about yourself, a little bit about Yesh Tikva and what you do?
And I made the mistake of introducing you before as I was waiting as Bracha, not as Natalie. But
I'm a
yes,
woman of two names, so you can do
amazing.
either.
Amazing. Yesh Tikva, Hebrew for there is hope, is an organization that provides emotional support and education around infertility and reproductive health.
Amazing. And, when we were talking about doing this live together all those months ago, something that we discussed is that people go through infertility and building their families in different ways for so many different reasons. And a huge piece of what I deal with and what I noticed when I was working in a clinical setting is that genetics is really a big piece for some people. Just for those who are kind of unaware of like, well, how could genetics really play a role in infertility? There's a lot of different ways. But one of the ways is because, the egg source and the sperm source can be carriers meaning they carry a non-working copy of a gene in the gene pair that they have. And that can put them at an increased risk for certain conditions. Sometimes it's recessive conditions, sometimes they're X-linked conditions. But a lot of the times people are caught off guard when they didn't know they were carriers, gave birth to a child or got pregnant with a child, and they only found that out after the fact. And it can feel like a really, really big shock to a lot of people. When you're dealing with the birth of a child, that's already a huge thing that you're dealing with as a parent, but then navigating that with a child who may have complex medical needs or may have, a difficult medical prognosis is something different. And why I love talking to people like you, Gila, is because Yesh Tikva is so good at identifying different needs for people who are building their families in different ways and really supporting them. Tell us a little bit, like for those who have never gone through IVF themselves or have never used assisted reproductive technology to get pregnant, tell us a little bit about how that can emotionally impact their journey, and why it's not just go for IVF, get pregnant, why it can really impact someone.
I think I'm going to start backwards to speak a little bit more about the why it's not just go for IVF and get pregnant. I think that when we understand, statistically speaking, what it means to get pregnant using IVF and understanding that for an individual under 35, that there is about a 50% chance that an IVF cycle might work. That also means that there's a 50% chance that an IVF cycle might not work.
And I want to pause
Um,
for a second because I think you're bringing up a good point.
yeah.
People think like IVF is a surefire slam dunk way to get pregnant. Everyone pause and say 50% is not
Yeah.
100%.
Right.
It's not that.
And those are for individuals who are under 35 and are more likely to have success. Now factor in more complications, which many individuals in the fertility community have. And there's that process of, we're talking about once you have a transfer, what happens for those who can't even get to the phase of a transfer, whether it is for genetic reasons or for other reasons that they aren't creating viable embryos to transfer. But the statistic that's available right now is really just on once you have a viable embryo and you transfer it, your likelihood of getting pregnant, which has increased from the 20% for the population who is trying on their own in the first 12 months before they get an infertility diagnosis, from 20% to a 50%, or for an individual with an infertility diagnosis from a 5% chance to a 50% chance, which is, if you think about it, a huge jump, which is why we hold on to hope and we process through this journey. But at the end of the day, it's not a sure guarantee. And that is a big emotional strain to continue to hold on to hope through a journey where there is no promise that you are going to be holding that child in your arms that you are dreaming of. You're hoping and you're holding on to hope. And that's why you continue to process through this journey, and go through cycle, potentially after cycle, towards that goal. But it definitely has a tremendous emotional impact, just physically going through the day-to-day process of it, with injections and hormones raging through your system, and doctor visits that take time, and that are physically draining, emotionally draining. And then the biggest piece of it is just the waiting. There is so much waiting.
And
Waiting for an answer.
uncertainty, like you're
Yes.
saying.
Exactly. So it definitely has a tremendous emotional strain on an individual, regardless of what got you through that door to start the process.
Yeah, and I think the huge point that you brought up, which some people don't realize, again, I'm very open about this. I'm an IVF mom of two, but the idea that not everybody gets to the transfer stage, right? Like I think we have been so lucky to have the technology that is IVF, that assisted reproductive technology, that we just think like if you pay some money and you do some hormone shots, you're gonna like you said, you're gonna get a baby. But the reality is that so many people will go through the horrendous process for some people, that is the workups and the IVF retrieval, and they have the sperm that they need and the eggs that they need. You know, they get to this point, right? Not everyone even gets to that point. And then the embryos they use are non-viable for whether that's genetic reasons or other reasons. I think it's a huge point that a lot of people miss. What I think adds a very interesting layer is that people who end up, in a primary infertility situation, meaning they couldn't have children, they went through assisted reproductive technology, whether that's IVF or IUI, that's their path. That's a whole level of grief and disappointment. Yeah. But I think it's different when you have someone who had a child, without the help of assisted reproductive technology, and then finds out that the way that they will reduce risk for a genetic disorder, the only way they can do that is with IVF. And I'm curious if you've seen that look a little differently, like people feeling like almost like an imposter syndrome, like, but I can get pregnant, so maybe I don't really belong in the infertility group.
For sure. And I think even to add to that, individuals who've been tested prior to having children, so they haven't had the opportunity to even try and know that they can get pregnant. Their first step to, I want to grow my family, is a workup at the doctor's office, because they already know that the only way that they're choosing to have a healthy family is through, or a healthy child, who doesn't carry the genetic disorder that they are carriers for, and does not present with the genetic disorder that they are carriers for, is this ability to grow their family through IVF. And it's a tremendous privilege. It is, as you explained, expensive, time consuming, and add on the cost of PGD, which is another couple $1,000s into this process. And again, not the guarantee, but there's definitely a sense of this concept of, I could have gotten pregnant on my own, therefore I'm not necessarily infertile, therefore I don't deserve or belong in the resources that are created for individuals who are infertile. And my answer to that is, of course you deserve to be a part of our community. You're very much a part of our community. It isn't how you walked through the door, it's that you've had to walk through the door and have had to go through this process to grow your family, that makes you a part of this community that most of us don't want to be in, but are so grateful that it exists.
And I think that's huge. And I think for anyone who's listening who feels like, yeah, I mean, it could be helpful for me, but I like I said, I don't identify with a lot of people's journeys. I think Gila's put it so beautifully. You had to walk through the door. It doesn't really matter why you had to, and you deserve that support. And Yesh Tikva is an incredible organization that provides that support. I want to talk a little bit about, and I think this is something very tricky, and I'm curious your thoughts if you've gone through this, but like IVF, I tell people always, is a job. It is a full-time job, especially if you are the person with the uterus and the eggs, right? You are going in for screening, I would say on a daily, sometimes weekly, if you're lucky basis. You are monitoring every single step of your life. You are medicating, et cetera, right? You have this full-time job. And again, how does that look like for someone who also has a child with complex medical needs, right? They have to navigate their care, how that can feel really draining, and why they may need more support maybe than someone who doesn't have children just yet, because they're being pulled from so many different sides.
Yeah. And I think that the point is that regardless of if you're going through a fertility journey, and you could speak to this more than I can, raising a child with complex medical needs that you've helped these families with, and I don't have a understanding from the genetic counselor perspective of what it means to help that family through it. But I can only imagine that those complex needs in and of themselves are a full-time job. So now adding on, and I can speak to the full-time job that a fertility process, an IVF journey entails, as you described, between doctor's visits, dealing with your doctor, dealing with your nurse, making sure you're doing everything right, second guessing yourself. Wait, did I get the dosage correct? Oh no, my medication didn't show up. Now I need to call the pharmacy, or the pharmacy sent the wrong meds. Am I doing everything right? Just that burden, and dealing with the billing department. I mean, I also share very publicly that I myself am a parent through IVF, and I mean, I cried a lot on the phone with the billing department. It is a lot. It is a huge burden to carry all this while still being able to compartmentalize and juggle your other obligations in life.
Yeah, and it's huge. And like, again, like, the world doesn't stop because you're going through treatment, unfortunately, right? You still have to show up to your job. You still have to show up to your commitments. Yeah. And so I think it's huge. And I would say, like, you know, as somebody who's dealt with families who are dealing with children with complex needs, like, this is a situation where I think sometimes in life, we love to power through on our own. We're like, we can do it. This is not one of those. Like, you need to get help because you are only one human. Yeah. And if that's help with childcare, or that's help with, you know, navigating IVF, so having, you know, a partner or a friend drive you to appointments, yeah, so that you can be on the phone with caregivers or other things, like, I think it's hugely important having someone, you know, try and make you some food. So that's one less responsibility. Take the responsibilities that can be, you know, shared with other people in your life. There is huge. And I think that's important. I want to talk about one other thing that comes up a lot, I would say, with people who I've talked about who have a previous child that they love that has a complex genetic disorder, and they still choose to do IVF because of bandwidth, right? Because they only have so much bandwidth to deal with this child, and they want to make sure that they're giving that care to the best child, and to make sure that if they want future children, that they can, again, take care of those children and take care of the child they already have. Sure. But discussing, and again, I think we don't talk about it enough, but like the feelings of guilt that can come up with IVF, specifically when you're doing it for genetic reasons, of like, you know, does this mean I love my child with a genetic disorder less because I'm choosing not to have another child? Obviously, it doesn't mean anything like that, but people can really experience that guilt. And that can, again, weigh on a journey more than a different journey for different reasons.
Definitely. I can only imagine.
Yeah. And I would say, like, getting emotional support, being able to talk that through with other people, like, you know, trained professionals, like at an organization with Yesh Tikva, is going to be important because it's a very different piece that others may not understand.
Yeah, definitely. It's a good idea for another support group to be offering. Is one.
I know, I'm putting more work for you.
Okay, we're gonna take this conversation and continue it off alive, and see what we can do to ensure that there really is enough support for those who are facing infertility for for genetic reasons, who have a child already with that complex genetic need, and what that might look like. So definitely we're ready to have our first to do on how this conversation continues.
Sure.
Can I add a question here?
Sure.
I think for the Yesh Tikva community, for those who might not be as aware, can you explain a little bit about the genetic component and why IVF becomes the resource that individuals turn to have a child that does not carry that same genetic?
Absolutely. So I'll go over it I would say broad overview. If you're more interested, you can definitely look at us up at JScreen. We have a lot of really great information about genetic conditions. But essentially, when we're talking about genetic disorders, sometimes people have a preview before they start having children. They do what we call reproductive carrier screening. So that will screen them for conditions where they may not know that they're a carrier, meaning they may not know that they carry a non-working copy of the gene, and their body, because they have a second copy, is doing all the work it needs with one working copy. So they appear healthy. And what can happen though is that if they have a child with someone who's a carrier, meaning who also has a non-working copy of the same genetic condition, there's a 25% chance, or 1 in 4, every time they get pregnant with each other, that they pass on the non-working copy of the gene from the sperm source, from the egg source, and they have a child with no working copies, has a genetic disorder. And like we said, sometimes we find that out when the baby is born and the baby is not developing in a manner that we would expect, or there's a crisis at birth. Sometimes we find it out on an ultrasound when someone is pregnant. It's another surprise. So there's really lots of different ways that people find out. It is often a surprise for people because they've lived their whole lives, healthy, their body is working the way they need it to for them. What becomes amazing about something like IVF, specifically with the technology of PGTM, or pre-implantation genetic testing for monogenic diseases, is what we can do before someone has that embryo placed back in their uterus, or whoever's going to be carrying that pregnancy, is we can actually test the early stages of the embryo by blocking a few of the cells that typically, when they do it, are going to form the placenta later, so it won't harm the embryo. It shouldn't. And we can test and look to see how many working copies of the gene we're looking for that the embryo has. Does it have 1, 2, or none? And we can select then to only put in embryos that have at least 1 working copy of the gene. And that's a screening method that can be really helpful to ensure that we've lowered the risk for this genetic disorder to happen again. We can also confirm that once someone is pregnant, we can confirm that with diagnostic testing in a pregnancy. So something like an amniocentesis or a CVS. We can also wait till baby's born and test again. But it's a hugely important thing that has given so many people hope, and allowed people to screen a pregnancy even before it's started. So that is kind of why we really recommend it for people who are looking to get that information before a pregnancy, especially when they've gone through a previous pregnancy that was affected, meaning the child had the genetic condition. And again, some people will say, well, how come everyone's not tested beforehand? Everyone has different care in this country, right? Some doctors are really great at screening people with reproductive carrier screening. Sometimes they're not. Sometimes people had reproductive carrier screening a long time ago and they never updated it, and the panels get bigger and better. And so that's another thing that can happen. There's a lot of different reasons. So I think it is really important. And this goes back to a big thing about we both believe in is patient advocacy.
Yeah.
If we're thinking about, planning a pregnancy, whether that is, on your own or with the help of something like assisted reproductive technology, it is imperative that you and whichever other person you are having this pregnancy, whether it's a partner or a donor, is appropriately screened, and that you can look at that with your own eyeballs, not just saying like, oh yeah, we did it, but give me a copy of the test. I want to see that. Because it's tricky. It is.
Yeah.
I always like to say to people who are interested, maybe they don't have like a primary care provider, they don't have a doctor that they use, you can actually order carrier screening yourself through JScreen. And you can log on to the website, jscreen.org. There's a $49 registration fee, and then the rest can be billed to your insurance. If you don't have insurance, the test is $249 out of pocket plus that $49. There's also incredible testing for hereditary cancer, which a lot of people like to do as well, and that's a whole other conversation. But if you're in the IVF space, a lot of people will like to do that as well, because again, if you would do something different based on the information, it's important to do it before you start IVF, as opposed to finding that out a little later. So that's a little bit about this. Gila, it is amazing to always talk with you.
Likewise, this has been wonderful. Thank you for making the time and for encouraging this conversation. It was both wonderful to be able to have it, but also I walked away learning something. So thank you.
Of course. And I want to tell Yesh Tikva, if you are someone who is going through a genetic journey because of whatever that reason, and you would like to seek fertility support, Gila, where can they find resources for Yesh Tikva?
Well, they could visit us at, firstly on Instagram. We will provide them in DMs any information that they need, or they could visit us at yeshtikva.org, as well as email us at support@yeshtikva.org. But I think the quickest and easiest way to find us is DM us. And how about for those in the Yesh Tikva community looking to learn more about JScreen?
Same thing, you can DM us. We check our DMs. We have different people on the social team checking our DMs. You can also check us out at jscreen.org. I want to tell one other thing. Again, I'm a big Yesh Tikva fan. Gila knows. But I think one of the most incredible things, besides for all the amazing things they do, but one of the most incredible things is that you guys offer mentorship for people who are just starting out. So IVF is a really scary journey. I consider Gila my mentor. I'm sorry, I'm putting that in the world, but IVF is a really scary journey, especially if you don't know anyone who's gone through it, or the person who went through it like 20 years ago when it looked really different. Yeah. If somebody wants mentorship, they can get that through Yesh Tikva. Yes. Is that correct?
It is called Fertility Friends, and we are constantly getting new mentors who are being trained. We train our mentors to ensure that they show up as a listening ear for you through your journey, and whether someone wants a mentor or is looking to become a mentor, Fertility Friends is that program. So thank you for the shout out, and always here. It's a journey that no one should have to go on alone. It could be very debilitating, and just having someone or lots of people to lean on makes all the difference between being a 1 in 6 versus being part of a community of 1 in 6s.
Absolutely. I'm going to pop off, but thank you so much for having me today. And we will do more collaborations in the future, because this is an amazing, amazing organization. We love working with you guys. Thank you so much for your time.
Looking forward. Thank you.